In videos past, we have talked on the subject matter of toxic chemicals, and in this particular video, we want to go ahead and focus on one in particular. Hello, my name is Dr. Robert Bartosh, and I'm with Proactive Wellness and Injury Center. And as I said a few moments ago, in this video, we want to focus on a chemical known as BPA, or bisphenol-A. It's a very insidious, very damaging and dangerous type of chemical that unfortunately is getting into our bodies through the diets that we eat, through the beverages that we drink, through the air that we breathe, the cosmetics or hygiene products we may be using, and many times unbeknownst to us. And what happens is, once it gets inside the individual, it starts to block a hormone known as estrogen, a very powerful hormone indeed. And not only does it do this, but it also becomes a hormone mimicker, if you will. It confuses the body into believing that it is a type of estrogen as well. It's interesting to note that back, I believe, in the year 2004, the Center for Disease Control, the CDC, conducted a survey with the National Health and Nutritional Examination Survey. And from that survey back in 2004, it was estimated from the results that over 93% of our population from the age of 6 years old and older were contaminated or had this BPA within our systems. This was back in 2004, down to 6-year-olds and older had this chemical in their bodies. Now, what's interesting to note, and very alarming in fact, is to realize that this BPA is linked to early onset puberty. Early onset puberty, this is especially affecting young girls where they are developing far beyond their age. As a matter of fact, as a point of note, we had in our center quite a few years ago a young lady, and when I say young, she was 4 years old, and at the time she was beginning to develop breasts and also develop fat deposits around her hips and whatnot. She was maturing far beyond her time, and based upon further research and examination, we found out that indeed this young lady was infested or overwhelmed with BPA. And the good news in this was that after we discovered this, we changed her diet, her eating habits, her environment. We detoxified her body, and I'm happy to say, and as her parents are, she has returned to normalcy and is developing like any other young lady her age should be. Also, this is linked to weight gain, diabetes, obesity, and also insulin resistance. So for many people that are gaining weight despite the actions that they're taking in reducing their caloric intake or exercising, they're still gaining weight or having weight issues. People that are watching their diets and are exercising are still succumbing to diabetes. We have individuals that just can't seem to lose weight, becoming obese, and also developing an insulin resistance, wherein their body now is not reacting to the hormone of insulin, linked back to the ingestion or the presence of BPA in their system. Also with this, we have hyperactivity and aggressive natures in young women as well. We're finding in schools, it's interesting to talk with school teachers because now the disruptors in the class has been, the mantle has been passed, if you will, from the gender of male to female, and now the young ladies are becoming the aggressors, the disruptors, and even becoming hyperactive in the classrooms. Interesting to note too is the tremendous increase, almost meteoric rise of the PCOS, the polycystic ovarian syndrome. It is not uncommon now for us to encounter an individual coming into our center, and I would guesstimate probably 3 to 4 out of 10 young women coming in now are being diagnosed with PCOS, the polycystic ovarian syndrome. And you have to understand that for every effect there is a cause that has preceded us, and for every problem there has to be a solution. We're seeing now that these problems are increasing now, especially in expressing itself as the PCOS. Also, we see a rise of breast cancer despite all of the actions that have been taking place, the jeans that are being worn, the ribbons that are being worn. We're seeing more women now developing breast cancer than ever ever before, despite all of the research and whatnot. Also an increase in fertility and behavioral disorders. And when I'm speaking of behavioral disorders, I'm speaking primarily of mood or depression issues that are occurring especially in young and middle-aged women. And as well, we go on to as I noted, the breast cancer incidence, not only limiting to that, but also reproductive cancers as well. So that's the bad news. And one of the most effective actions that you can take when the question is asked, well, what can I do about it? One of the best things to do is to rid your life or your lifestyle of rigid plastic containers and many plastic articles, because we're finding that these rigid plastic containers actually have the BPA within them, and the BPA is being leached out into the food that is being contained, and also it increases if the plastic is scratched. That releases more of the BPA or the chemical into the food. If the food is containing an acidic food as well, and or if the container is heated. If you're heating your foods in plastics in the microwave, I would urge you to cease and desist, because that is a monster being released into your body, chemicals now that you're ingesting, even unbeknownst to you. And one thing or a few things that you can do then is to exchange these containers, these bowls, for things like glass containers, or eating foods that are fresh or frozen in lieu of those that are packaged. And please understand that the canned foods are very notorious for this, because on the inside of the can, many of them are covered with this BPA or a chemical that's very similar to it. And while the food is in the canned good, it is leaching out into the food, and then you're ingesting it with the meals. So as I alluded to earlier, buying fresh, frozen, or using glassware to cook in, and it was a few years ago people were saying, well, and even myself, I was recommending that individuals buy BPA-free types of containers, or water containers, or whatever it might have been. And for a while you were seeing containers that were labeled BPA-free, BPA-free. Unfortunately, marketing has caught up with that, and they label it as BPA-free. However, there is another chemical that has replaced it, and it's the BPS. It has replaced the BPA, and it's doing the same damage to the body that was being done by the BPA. So it is a powerful marketing tool that they use, but it's no longer true that you're getting BPA-free types of containers for the foods and the beverages. So what can you do? Again, I might refer you to a video that we did quite a while back that identified the different plasticizers in plastic containers, especially in the water containers. I'd invite you to view that as we give you the numbers to look for, to know where there is a less of a possibility or potential of getting these chemicals into you. Changing the lifestyle, as I recommended earlier, eliminating many of these containers, certainly not using them when you're microwaving foods or containing the foods in the refrigerator, going to fresh or frozen, using the glass or the Pyrex type of cookware. And another thing that you can consider doing is getting a detoxification program on a regular basis, because you see, it's no longer just limited to people that work around contaminating or toxic types of chemicals. It is spread to each and every one of us, and there's not much that we can do to escape our environment. One thing we can do as a proactive means is to go ahead and get a detox on a recurring basis throughout the year, realizing that you are taking these toxins in even at a suppressed rate. And we're more than happy to help you with this. If you do have questions about it, we do invite you to contact our office, because it's one of the services that we provide for our patient members when they come in. I do want to thank you again for viewing this video. I hope it's been beneficial, and it's another step that you can take in maintaining or assuring the best performance of your life. Thank you, and God bless.